Good afternoon, everybody. My name's Scott McGann with the Falmouth Health Department. Today's February 10th, 2023, doing our every other week COVID-19 update for the town of Falmouth. Our email is health@falmouthma.gov if you want to contact us or call us at 508-495-7485. So 6,250 PCR tests since the beginning of the outbreak. Remember, these are only PCR, so when we start talking about incidence rates and positivities and confirmed cases, it's only PCR. Home tests are not reported to us. They're not, nothing happens to those we don't know. That's the vast majority of positive cases. All PCR allows us to do is compare to what previous weeks were under the same conditions. So for this past year, 2022, most of the year was just about all the year was home tests. So you can kind of compare it to itself. You just can't compare it to pre-home tests where you had, a much truer sense of the actual case count. So 73 over the last 2 weeks, and we've been averaging over the last 4 weeks, about 40 cases. Our incidence rate was down 1.3 to 17.8, and our positivity, the number of tests that were positive, is down 11.2 from 2.59. Still relatively high numbers, but again, PCR is really going to be more limited to healthcare settings. So a nursing home, if they're retesting, things of that nature, assisted living, the hospital testing before procedures, things of that nature. So PCR is much less used, so doesn't give you necessarily a good representation, other than the only thing I'd tell you to take from it is that if PCRs go up, it's reasonable to say that all cases are up. It sort of is going to go up by whatever factor, up and down by that same rough factor. So if we get 73 over that 2-week span, and we have some number that's 4, which puts us to like 290 as a multiplier, then it was 290, and it's all related to itself. So it would go up by that same factor each and every week, just about. So take the case counts, like I say, every week, every other week, with a grain of salt. But just compare it to itself. We had a better week than last week, and you'll see that. Also with CDC guidance. So CDC is using hospitalizations because, when you go to the hospital and it's because of COVID, that's is easy to quantify and would be the same regardless of the type of test that you took. So it's a better indicator. So they take case counts and hospitalizations, and they come up with this metric with low, medium, and high. And we've been in the medium for a few weeks. We went high a little bit, and so I think right around the beginning of January, there was a week or so for the county. Again, this is by county, but relative to itself, relative to last week, we were lower. I think we're case rate per 100,000 in this past week was 90.61. It was like 120 when I did this a couple weeks ago. We went from like 13.5 to 12.5, and then from like 5% of inpatient beds used by patients with confirmed COVID from like 5% to 3.9. So it's a better trend. Cases are, relatively high. They have been for some time. Omicron spreads pretty well. So case counts are what they are. So, COVID's always going to be around, and it's going to be worse in January, coming out of the holidays, sometime late December through January. And you can see that by this chart here, which is the hospitalizations from day one. So 2020 on the far left, up to 2023, and you see the 2021 in January, the Omicron, even with all the shutdowns that we had in 2021, Omicron still caused that spike. Not Omicron, sorry, Delta. Omicron is the next one in 2022. So many cases. There was a ton of cases at that point. That was the highest amount of cases that we had. Just the sheer amount of cases, even though Delta was more likely to put you in the hospital than Omicron, it still caused a great spike. So look at 2023, it just follows that same pattern, but not to the same extreme. So that's good. That's vaccines, boosters. We do no mitigation per se, so some people wear masks, a lot of people don't. We don't have things shut down, we're in person. And even with that, spike not being anything near the other ones tells you that, things are in fairly good shape. It's just, you're most likely to catch it in January. So hospitalizations follow the cases. More cases, more people go to the hospital. So not atypical of any respiratory, cold flu season. This is usually the peak. So, but the last couple weeks of good news is this bump in the road here is turned on a downward trend. And for the most part, that's what you're seeing, a little bit less than what we've seen maybe 3 weeks ago. Incidence rates, again, take this with a grain of salt. This is based on PCR. We were on the higher end for incidence rate in the county, and middle of the road for positivity. Looking at the state, this total number of cases, this comes out every week. Last week it was about 1,200 higher for the week. This, again, PCR based. What's good about these shots is the next one just gives you trends. What are we doing on a trend basis? All of them are sort of just like we went up with the hospitalizations, and we went up a little bit with cases in early January, so did all these numbers, which makes sense. And they're sort of dipping back down. So, there'll be an ebb and flow to this, and we're on, sort of a downward and probably flat trend right now. It's probably if I do this in 2 weeks, it'll probably be relatively the same. MWRA, this tracks RNA. This tracks the virus in wastewater. I just happen to use the MWRA for this chart. The northern region in green, the southern region, southern half, the south part of Boston, greater Boston area in orange. And you can see that same right around the first week, end of December into early January. You see it go way up, not way up, but up. Look at the far left. You can see that was off the chart with Omicron of 2021. So nowhere near that. Comes down. And now it's going to be bumping up and down and bumping up and down, bumping up and down for a bit. And then, when you get to the summer, it generally is lower. So the trends, sort of following what the trends that we've had for since we've had the vaccines and the boosters. And Omicron's been the different variants within Omicron have been their primary, what's been there this is kind of what you're seeing. Again, CDC recommends that people 5 years and older receive at least one updated bivalent booster if it's been at least 2 months since their last COVID vaccine, whether that's their primary dose. Your primary dose will be not the bivalent, just to let you know if you're going in for the first time, it'll be the monovalent. And so you can continue to do that if it's been at least 2 months. They're out there. You could schedule it and get it within a day or two. The Walgreens and the CVS and the Shaws and the different areas will do it. So you just go on vaxfinder.mass.gov and you put in your zip code. It comes up with places, and it's pretty easy to do. Young children under 3, contact your pediatrician if you're considering that for your child. Testing, again, home kits are primarily, I just got a shipment of home tests. There's some at the service center, there's some senior center, some here at Town Hall. Just gave the library some. State's given us some free, whenever they give the opportunity to get free test kits, we do take them. I think that's going to go away in the spring. I don't think the state's going to continue to provide them for free. But when they do, we get them and we distribute them. So if you need a home kit, you can do that. So home kits are your primary way that people are testing, but you still have the hospitals open, and there's still ways to get PCRs and so forth. You can still get tested in places like Convenient MD, but most people are relying on the home kits. Which home kits are good. They're accurate. If it comes back positive, you definitely have it. If it comes back negative and you have symptoms and your spouse was just infected and you've stopped found that they were positive, and a couple days later you're not feeling well but test negative, that doesn't necessarily mean you're negative. You should test again the next day. So sometimes when you have a low level of viral load, that it doesn't necessarily pick up on the home kits. Now if you're positive, it's definitely positive. So that's the way these home kits work. So you can test a second time, especially if you're symptomatic and you were in a close contact with somebody, So you can test twice. There's two in a package. Vaccinations, I think we gained, 127 vaccinations in the 2 weeks since the last time I did this, which is about 85 boosters, second boosters, bivalent, 33 first boosters, and very little first vaccinations or second vaccination of their first series. So that's definitely slowed down. We only had, according to the state, this is the state's numbers, 10,000. So about a third of our population has gotten the bivalent booster or the second booster dose. About half has gotten the original booster, and somewhere around 90% or so are fully vaccinated. I'd say some between 85. Some of these 92% is a very high number for first doses. Some of those belong in the boosters. But people may have given misinformation to the person doing it and filled it out into the column, and that's where that goes. So I think we're a little bit higher than 56% and 32%. Probably not a ton, but let's say a couple thousand of those belong over there. Still, we don't have half of the people in the town, half our residents with second booster doses. So that's where we are with vaccinations. What is out there? The XBB 1.5 is still your primary one. There's a rainbow of other colors and other different variants that are still around. but primarily, vast majority, if you look at the 21123, it's, I would say 90 to 95% XBB. That's the variant that's out there. So that's not uncommon. These variants come in, they take over, then they get outcompeted by the next one. I'm not sure what the next one's going to be, but right now it's the XBB 1.5. Still an Omicron, so you don't have the same Delta issues, but that's what it is. And so for a recap, it's very similar. You know, we're sort of in a medium category. It's wintertime, cold flu season. Going to be, you know, COVID's going to be on a little bit on a higher, not quite as high as a couple weeks ago, but it's, you know, there's plenty of COVID around. So again, bivalent boosters, plenty of home kits, plenty of places to get tested, plenty of places to get boosted. The mandates, there's no change in any of the mandates. The only thing that still exists is a recommendation by the select board to mask in town-owned property, buildings rather, not property. But there are no talks or discussions about implementing new mandates at all. I say that usually every other week. So that's where we are. It's medium. I think when I do this in 2 weeks, it's probably going to be a very similar, hopefully downward, continue on a slight downward trend. And that's where we are. So I'll do this again in a couple of weeks, and everybody take care.